Hello?
Hi, this is Leah from the County Health Department. Is this the phone number for Nancy Elliott?
Yes, this is Nancy.
Great. I have personal health information for you, but before I can release this information, I need you to confirm your full name and date of birth.
Yeah, my full name is Nancy Elliott, and my birthday is March 18, 1978.
Thank you, Nancy. The reason I'm calling you today is because of COVID-19. What have you learned about your test results?
I haven't heard anything yet.
The health department informed us that you tested positive, and that's why I'm calling you.
Oh no. I, um, I didn't know. I've had a headache and some digestive issues, but I got tested because my coworker Susie was having cough and headache, but I hadn't heard back from her and she tested. I haven't heard that she tested positive. And I thought I would be okay since I wasn't around her. Why hasn't Susie said anything?
I understand your concerns, Nancy. I'm here to answer any questions you may have and follow up with Susie to see how she's doing and anybody else you've been around. I'm also glad you got tested regardless of Susie's status.
I haven't even gotten my test results back from the clinic, or at least I don't think I did. How do you have it?
Great question. Your testing center should have notified you of your positive test result, maybe through an email, app notification, phone call, that kind of thing. Since you haven't received anything, I recommend calling them to see why you were notified as soon as possible, or check your spam mail, medical record online, or see if you've missed a call from the testing site. Now, the health department received your information from your testing site because COVID-19 is a reportable disease. A reportable disease is one in which regular, frequent, and timely information regarding individual cases is considered necessary for the prevention and control of the disease or condition. My job as a contact tracer is to notify you of your positive COVID-19 test to help prevent you from spreading the disease, provide some education, and to answer any questions you may have. So it's to protect you and the ones you spend your time with, and even strangers who you might have been around.
Okay, I had no idea the health department would be calling me. I guess I'm glad you did because as of today, I'm feeling fine, and I was even gonna have my daughter take me to the coffee shop to get out of the house.
It's good to hear you're feeling fine. And yes, I'm glad I've called you when I did. I'm going to provide you with education and your isolation dates and the contact info of any people you've been around.
I'm around my husband, who's not the healthiest, and I'm really worried for his health. And now that he's been around me, I'm very concerned for him. Do you think he has COVID-19?
Knowing whether he has COVID-19 will require testing. If he hasn't been tested, I highly recommend that he goes and gets tested as soon as possible. Do you and your husband live together?
Yes, it's me and my husband and my daughter.
Okay. So, since you all live in the same household and are frequently around each other and touch the same surfaces, I recommend that both your daughter and husband get tested as soon as possible.
Okay. Um, will my daughter be okay? Because she has diabetes. How does that work with COVID?
I certainly hear your concerns about your husband and daughter. COVID can be a very serious illness. But since I don't know you or your family's medical history, and I'm not a medical care provider, you'll have to talk with your medical provider to discuss these health concerns. But I can answer isolation questions and general COVID-19 questions.
Okay, thank you. I just feel like there's so much to discuss, and I don't even know where to start. I'm really concerned for my family's health.
I can't understand exactly what you're going through and thinking, but I was in a similar situation just last month with my older brother. This is a scary time, but I, along with the health department, are here to help and provide education and resources. I have some questions that I need to ask you in order to understand you, your family, and close contacts risk.
Okay, thank you. That makes me feel a bit better. I just really hope my husband and daughter are okay.
As do I. But to start off, I'd like to focus on you and your symptoms. I know you mentioned you had or are having a headache with some digestive issues. Tell me more about those symptoms.
Yeah, I still have a headache, but no more digestive issues. Um, I had a like diarrhea, but that lasted for like a day or two.
Okay. What day did you start having symptoms?
Uh, I don't know, maybe five days ago.
Okay, so to confirm, your symptoms started last Tuesday.
Yes, and now that I think about it, my throat was a little dry. I, I feel so bad. I've exposed my husband and my daughter, and I had symptoms. I didn't even think about it. I really thought Susie would let me know, and I even thought I wasn't in close contact with her, just in, passing, really. What if my husband gets admitted? I couldn't live with myself. And then our insurance, it's not even good. How am I gonna pick up prescriptions and groceries if my daughter must be in quarantine? Um, is there a transportation service I can use? Can't believe this. How can I be so careless?
Nancy, I hear your concerns, and I'm going to provide you with information that can help to keep you and your family safe. I'm here to help you. And if I don't know the answer to one of your questions, I will make sure to call you back with an answer. I certainly acknowledge your feelings and your fearfulness and want to help you get through this.
Thank you so much.
What did the contact tracer do well? The contact tracer provided objective information to the patient and provided in-depth answers to all questions. Notice how the contact tracer did not try to relate to the case's situation by using words like, "I understand," and "you will be fine." Instead, the contact tracer showed empathy by saying, "I hear your concerns," and "the health department is here to answer any questions." By using empathy and validating the patient's feelings, the contact tracer was able to build rapport with the case. This allowed the case to feel more comfortable answering questions.